where do you see healthcare in the next 10 years from now?
Hopefully better. I watched a clip the other day, Noah Wiley speaking, and he was talking about, healthcare is human, and I'm like, oh my God, is it not? Hopefully you'll get, I don't mean to get political, but hopefully you'll get big pharma out of it making the decisions. Hopefully you'll get business people out of the decision-making process for insurance reimbursement. Hopefully we will have more preventative. Hopefully patients will not have to jump through 5 million hoops to have procedures done. Hopefully things will be covered that will, make life better. I mean, hopefully healthcare will be moving in the right direction.
Yeah. How has technology changed medicine from today?
Many ways good. Many ways good. You have access to information a lot quicker now. You have help with documentation, from dictation to AI, kind of being able to participate and record conversations between your provider and the patient.
Mm-hmm.
I'm not 100% sold on that. I would prefer to have a little more control. So I'm all about dictation as opposed to full-on AI.
Mm-hmm. Mm-hmm.
The medical records, the electronic medical record system, the EMRs, being able to flag results and, recommend, hey, this person might need this person might need that, based on, quality measures, reminders. This patient needs a mammogram, it's been a year, or this patient needs a PSA, it's been a year. So there's been a lot of good, patients being able to have access to their charts quicker, but sometimes that can be a little bit, well, it says it's supposed to be that. Well, I can't help that pharmacy doesn't have it ready, Technology has been good, but it's also been bad because people will Google their symptoms and be convinced they are dying.
Yeah.
So
and won't believe the expert.
Right. It's a double-edged sword.
Yeah, I get it. So you talked a little bit about telehealth a little bit. Where do you see that helping rural communities especially?
Chronic management of conditions. I do not feel that telehealth is appropriate for sick visits because as a provider, I like to see my patients.
Mm-hmm.
I like to touch my patients. I like to hear my patients. I like to be able to, listen to heart sounds, listen to lung sounds, actually, see their throat. I mean, I don't care if you have the most up-to-date cell phone, you're not going to get good visuals,
Mm-hmm.
There's a break in that,
Yeah.
But with chronic management like diabetes, congestive heart failure, coronary artery disease, hypertension, there is a place for telehealth with that. Mental health, being able to do your counseling online as opposed to take a day off and, trek down to the counselor's office and, sit on the couch for an hour or whatever, that is, I feel telehealth is most beneficial for management of existing conditions.
Yeah.
I do not feel telehealth is appropriate for diagnosis of conditions, be it physical, mental health, etc.
Yeah.
I feel it's not the place. I feel human interaction is necessary.
Where do you see the role of AI playing in the future of healthcare?
I worry. I worry. I do. I hope it is an accent to healthcare, not taking the place of human interaction.
Mm-hmm.
I hope it's just an adjunct. I hope it's a tool.
Yeah.
And not the provider.
Right. Yeah. Taking jobs.
Yes.
Yeah. Once it starts taking jobs in the healthcare, it gets scary.
It does. I mean, I think AI is amazing.
Mm-hmm.
But you can chat GPT, Google whatever. You can do all those things, and there's always that disclaimer. Things can be incorrect. You need to, recheck.
Yeah.
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 How awful would it be for it to be incorrect with a human life?
Right. Yeah.
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 So I just using it as an adjunct, as a tool to assist, absolutely. But to take the place of that human interaction is kind of scary.